Hi, my name is Angelica, and this is the nuclear passion project of mine, which is sports medicine, titled The Nuclear Side of Medicine. Nuclear medicine can synergistically contribute to sports medicine by using nuclear imaging to assist in the diagnosis and monitoring of bony and soft tissue sports related injuries. For example, a bone SPECT, which is short for single photon emission computed tomography. This scan uses a radioactive isotope like technetium to make it easier to identify tendon injuries, ligament tears or strains, bone bruising, and fractures. Technetium 99M emits gamma radiation and is used as a radioactive tracer to assist in medical imaging, test finding problems in the body. This radioactive isotope is typically injected into the bloodstream amongst other alternatives and is taken up by certain tissues, allowing us to see injuries or abnormalities to organs, bones, and even the brain. This also has a low radiation exposure to patients, so minimizing the risk of using this type of radioactive isotope. Fun fact as well, technetium was found in 1937 by Emilio Segre in Italy. While investigating molybdenum and exposing it to high energy, he found that this element to be present and separated it when found. Here's a quick video on technetium. I apologize for the overlay.
Technetium turns out to be an extremely important element, in part because of its somewhat peculiar nuclear properties. Metastable technetium-99 lives for about 6 hours, and when it decays, it gives off typically a very high energy X-ray, and that's very useful for diagnostic purposes in medicines. So it's pretty amazing that you can create an element like that and that it ends up being very practical and very important for medical purposes. Here's matter that doesn't occur naturally, and we've created it, and it's very useful.
So that's a little bit more information on technetium.
Technetium turns out to...
Here is the balanced nuclear equation for my element. So again, it doesn't emit gamma ray emissions, so there was no change to the atomic number or anything like that. This also has a half-life of 6.0067 hours. Here is my first order integrated rate law and its half-life. The question that I did come up with 3.10 grams of technetium-99M was administered to the patient, which has a half-life of 6.0 hours. After 24 hours, how many grams are still present in the body? So step one, we went ahead and found the half-life, or K, by using the equation here, ln 2 over 6.0 hours, which was determined to come out as 0.11552453 hours. We proceed to step two, where we used our first order integrated rate law formula. Right here, we're going to go ahead and find the after grams that are left in the body. So we have ln of AT over 3.10 grams. Then we'll go ahead and input the number we found for K and the 24 hours. We go ahead and rearrange the equation, and we go ahead and raise those to the E, which go ahead and cancels out the ln. And we determined that it comes out to 1.19390 grams, We're going to go ahead and cut that down to 2 sig figs. So that would be 1.2 grams left in the body after 24 hours. And that concludes my presentation. Here are some of the citations for the information that I used on my presentation. I hope you did enjoy. Thank you so much.